Hello everyone, welcome to Medicare 101, and whether you're turning 65 for the first time or trying to get some more Medicare information, you are in the right place.
Medicare, it doesn't cover what most people think it covers. The biggest gaps that surprise people with Medicare come with critical illness, skilled nursing, and hospital stays. We call them umbrella packages, and I cannot say it enough, when you get a Medicare supplement, a Medicare Advantage plan, or you just have original Medicare, you're left with some significant exposures. When it comes to cancer, heart, and stroke, the big three we call them, medication costs, non-Medicare approved costs. And when it comes to skilled nursing coverage, after 100 days, there is nothing that Medicare gives you that will cover that. So you're either paying for it yourself or you need to have a plan in place. Lastly, hospital coverage. If you have Medicare only or you have a Medicare Advantage plan, you're left with a daily hospital copay. When it comes to Medicare penalties, there's some critical enrollment periods that you need to be aware of. And if you miss those enrollment periods, such as signing up when you're first eligible, especially if you don't have credible coverage, well, you can get a lifetime penalty that accrues to your Part B or your Part D for as long as you live. The initial enrollment period, that's when you're turning 65, and you have a 3-month window before you turn 65 and a 3-month window after you turn 65 to get signed up. So really a 7-month window, including your birth month. And if you don't sign up during that time, you could accrue a lifetime penalty. Medicare Advantage, Medicare Supplement, they're not the same thing. I always say if we were in an elevator together for 30 seconds, I would explain it like this. Medicare Supplement, it's gonna cost you more, it's gonna give you more comprehensive coverage and allow you to see any doctor and hospital you want as long as they accept Medicare. When it comes to Medicare Advantage, it's gonna be a lot like your group coverage. You're gonna have out-of-pockets, you're gonna have copays, you're gonna have deductibles, you're gonna have co-payments. It's really a pay-as-you-go plan, and if you have an unfortunate health year, it could cost you much more. There are a lot of different Medicare plan options, and what I always say is your budget may not be the same budget as somebody else, and your needs may not be the same needs as someone else. So there's a lot of different plans, a lot of different budgets, and our job is to find a plan that suits your budget and your needs. Medicare Part A and Medicare Part B, they cover different things. When it comes to Medicare Part A, think inpatient hospital when you're admitted into a hospital. When it comes to Medicare Part B, think outpatient, think doctor, think your family physician, or maybe an outpatient surgery. That's gonna be covered under Part B. Medicare drug coverage, it confuses a lot of people. Short answer, you don't have to choose prescription drug coverage when you go into Medicare. Long answer, if you don't have a prescription drug coverage and you want one down the road, well, they're gonna go back and penalize you for all those years or all those months that you went without a Part D prescription drug plan. So when it comes to insurance, if you wanna have coverage for the unforeseen events such as future medications, we recommend you get a prescription plan when you're first eligible. Big misconception is people think Medicare is free. And when it comes to Medicare Part B, that's gonna cost you here in 2026, $202.90 a month. And then you're looking at a Medicare supplement or a Medicare Advantage plan and possibly some ancillary coverage that will cover the additional gap. So big misconception, it's free. You've earned that entitlement, but there's additional premiums in order to get that Part B and extra coverages. When it comes to Medicare, one of the biggest misconceptions is that it's gonna cover assisted living, nursing home, or extended care. And I'm here to tell you that's blatantly not true. The most coverage that Medicare will ever give you is 100 days of consecutive coverage. After that, you need to have a plan in place or you're self-paying. Biggest thing people should do before they enroll in Medicare is just get educated. There's workshops, webinars, books, YouTube content. And when you get educated, you're gonna make the best decision possible and have all the information you need to make the right decision for you.
And as we wrap this up, I want to go through our 3-phased approach. So today, phase number 1, we're basically knocking out phase number 1. You're getting the Gruening Health and Wealth online content, today's educational workshop and seminar, and then you'll get a free copy of 64 Plus. And that's a #1 bestseller that will really take today's presentation in a book format and help you kind of slow it down, maybe circle things and take notes if you need to. And then phase number 2, the most important phase, is schedule your free consultation. Make sure that you get your individual questions answered. And we have a ton of incredible people at Gruening Health and Wealth that are standing by, ready to answer those questions. We've serviced thousands and thousands of Medicare beneficiaries across the country, and again, have that 5-star service and BBB accreditation to prove it and back that up. So we'd love to talk with you, would love to answer those questions, would love to help you plan for your Medicare and retirement transition. And phase number 3, that's our free lifetime billing and claim service. So we have a great full service team that's gonna handle any billing, any claims, any service, and really provide you the holistic support on the insurance side that you're gonna need throughout your retirement years. So can't wait to hear from you, can't wait to answer those questions. And then again, I wanna remind you that every year we're gonna be there for you. We have our free annual reviews So every year, October 15th to December 7th, that's going to be another chance to meet and make sure you have the right plan, not just this year, but for years to come.